Tell us about your practice for those that don't know you.
Well, my practice is in San Jose, California,
Okay.
and I do a great deal of specialty treatment, including laser treatment, cosmetic dental treatment, dental implant treatment. I use sedation dentistry.
Okay.
So it's very encompassing, and a lot of cosmetic treatment.
Before we get into these photos,
Yes.
What's changed in the last 15 years?
Well, I'm excited to share that information with you because a lot. And for those folks at home that are looking for a cosmetic dentist, my website actually has the top 10 questions to ask your dentist or a dentist that you're visiting about cosmetic dentistry. These are questions that a patient should ask the dentist, and the dentist should know the answer.
Okay.
So in any case, there's a lot new in cosmetic dentistry. First of all, there's always been cosmetic dentistry. That is not a new treatment. What's really changed is this. The technology has advanced.
The teeth look more realistic?
Well,
is that what's going on?
The teeth are very natural looking.
But I still see anticipating this interview,
Yes.
I look around, I feel like I could spot veneers 20 yards away.
Not mine.
Okay.
Not done by a...
They seem blocky or big.
Yeah, not done by a true cosmetic dentist because there's so much that goes into it. But first of all, the golden proportion of size, shape, and shade, and a laboratory that can produce that result that the dentist wants to have. The results are unbelievable, and they are stunning. I tell my patients, we're not going to have a good result, we're not going to have an excellent result, we're going to have a stunning result.
One of the things that sticks out every time I talk to you, that you're changing people's lives.
I am changing...
You believe that, because it's just teeth, I said to you.
Yeah, right. And I said it has nothing to do with teeth. It doesn't.
Okay.
The teeth are going to be made beautiful, but it has everything to do with the emotion that goes into why the patient even walks in the door to ask about it, first of all. And we go into these issues.
Okay.
And then once the treatment's done, I say to these patients, and they don't believe me until afterwards, and then they start calling me or sending me letters and notes. But I say the results are going to come back to you for so long, for the rest of your life. And there are results.
And they agree with this after it's
finally they do, because I tune them into how people and the awareness of how people watch them and look at them and react to them.
I guess I take it for granted because my teeth are naturally
Well,
good.
your teeth look good. Yes.
Thanks.
But not everybody. In
Okay.
fact, a lot of the population, I could help them a great deal.
Okay, let's start with this one.
So this is a young lady. And you can see from this photograph that she has yellowed teeth. I'm going to actually go through and do an analysis. Just off the top of my head, because I did this case some time ago and I don't remember all of the factors in it, but look at this. We have, first of all, the teeth are yellow. They're not in line. The long axis isn't there, so they're shifted. The gum line, particularly, I want to point out the gum line. There is not symmetry in the gum line. She knows that there's a real need for her to feel better about herself and to present herself to friends, family, the public. She was going into business for herself.
Okay.
So here's a before and after.
Beautiful. Just veneers.
And, well, it's a combination. This was a combination. Changing the occlusion, changing the bite, and crowns and veneers. But one of the most important things, and I've got to say this, laser treatment.
Laser the gums?
Laser the gum tissue. That means gently scalloping the gum tissue into symmetry. The highlights of this are symmetry. Symmetry is beauty. And when you see symmetry of the gums, of the lips, of the teeth, they're all in harmony. They're in a golden proportion.
She made her teeth longer, it looks like, too.
Well,
from before to the after.
We made, actually, the front teeth are more narrow and a little longer because it brought it into the ideal proportion. But that's what the cosmetic dentist knows. That's what he directs the laboratory to carry out. Well, here's another one, and this is a close-up of the teeth, and as you can see, the teeth are worn at the biting edge. Now, this lady isn't very old. I mean,
not a bad smile, though.
And not a bad smile, but the teeth are kind of square, kind of a masculine. They're not real feminine, and this is a very feminine woman.
And that bothered her. That bothered her.
Absolutely. And sometimes the patients, like I said, I ask them what they feel. Well, I can draw out some of the things. They can't put their finger on it, but when I mention something like that, too squared, not feminine, not soft enough for your smile, these are terms that they can identify with. So then this is what we get as an after.
Wow. Looks good.
Now,
great.
This is a stunning picture. Now this young lady is actually my dental hygienist, Kathy. And the folks at home, if they come into the office, they'll see and have their teeth cleaned by Kathy.
That's a perfect smile.
It is, and that's why I included it here, because it has all of the elements. You see, We're talking not about teeth.
And these are veneers?
These are actually true veneers because her teeth were very healthy, and we were just changing some shapes to be softer, more feminine. We were changing the shade to be a lot nicer, a lot lighter
The veneers
shade.
don't stain, you say?
Veneers are not porous like the natural teeth. One of the reasons that natural teeth wear down is because they're a little softer than the veneers, but also they take up stains, smoking, tea, just life's elements.
Okay. So is it more women than men that are coming in?
Well, the fact is that I think in today's society with cosmetic issues, aesthetic issues, more men are getting on board with this. The fact is that it's probably 70% or 60% women and 40% men, more and more men. And I have a lot of before and after treatment that I can show. Now, here's a guy, and if the folks...
Now that's you.
That's me. And if the folks don't, they won't recognize it because they probably don't know me. But by the way, tremendous amount of my patients come in and see the show.
They recognize you for the program.
It's a phenomenon. I love it. But this is me. This is me 5 to 7 years ago. It's actually, I don't remember how far back I did my own teeth. But the fact is that...
So what was wrong with your smile there?
Well,
in your eyes?
The teeth are dark. They're yellow, worn down, old-looking teeth. And this is an old-looking guy. I mean, that's just the way it was. This is life's process. And I want to show you after this cosmetic process. You asked why I'm so passionate about this. I've lived it. I go through every phase of this with the patients because I've been there. And I think that's terribly important, because if you see a dentist who looks like this, who their teeth look like this, again, I would question if that's the place you want to be. But now...
The dentist should also walk their talk.
Well, how else are they going to know emotionally, physically, how this process is?
All right,
I mean, it's what are they doing? They're just telling you what's out of a book, perhaps. It's not their experience. So here's my after, and now these
Good-looking guy.
These are young, healthy, white teeth. They're young teeth. They're not worn down.
Look at this.
And that's a good-looking guy. That's a younger guy.
Your teeth in the before and after, when we put these side by side, the teeth now are longer. In fact, they, like you say, follow the lip line.
They follow the lip line. They go into the buccal corridor, meaning they fill out that dark space at the corners of the mouth.
Interesting. So it's a big smile now.
And this is a young-looking person. I mean, people, if they're 10 years younger, 15, 20 years younger. I mean, this is an incredible process. It is not about the teeth. It is about life.
Now, I'm sitting right in front of you. I wouldn't have guessed that those are veneers.
Well, thank you. And that's how my treatment is produced. And it is natural. It is wonderful. I know the issues that go on in the patient's mind, because you think I wasn't worried about going into the treatment?
Yeah.
I wasn't sure how people were going to react to me, how I was going to feel about it. Was I going to be too
Do you smile more?
I smile all the time. Now, did I before? Maybe I did, but I wouldn't buy a veneer from that man.